their friends and family keep asking them, when are you falling pregnant? When are you going to have a child? Why haven't you fallen pregnant
Which
yet?
adds to stress.
It just adds to the stress. And if it's an unknown cause, then from a physical point of view, we look at regulating the female system, nourishing the uterus and the ovaries, and then stimulating the ovaries to produce a good quality egg. And if you produce a poor quality egg, you can find that pregnancy is not sustainable. So we do it from a functional medicine, from a herbal point of view, where we can actually help the patient to nourish, regulate, and stimulate the female system to produce a good quality egg, and then go on to have a viable long-term pregnancy.
So the point is basically to see if there's anything out of balance,
Yes.
and then work on
And
helping
work on
the
what's
body,
the
not just
imbalance.
artificially giving
Yes.
giving it to the body, but working on helping the body to be
Supporting the systems,
I love that, supporting the
So
system.
we need to look, so most of the time we request a blood test for these patients, and we look at which hormones or which part of the body is not happy. Sometimes it's not even a female related hormone, it could be thyroid dysfunction, and they're not having a
Everything
regular
is
cycle.
interconnected. We need to move away from this idea that the body is separate parts.
Yeah.
It's not. Everything is
You
interconnected.
have to
So
be
you might
treated as a
have
whole.
an issue in one area, but it's actually leading from this to this to this to this, and you need to make that connection.
Definitely.
Yeah.
So from a physical point of view, you need to remember that it doesn't have to be a single diagnosis. And although you are a single entity, you are also a holistic, a whole being. You're not part. You're not just, your arm is not separate
And so
from
your
the rest of you.
mental, your physical, your emotional, all of them are interlinked, definitely, right? From an emotional perspective, over the years, what I've seen is if there's an unknown cause as such, there's often underlying issues. They could be, a lot of times, I don't know, we don't want to talk about this, but sometimes there can be sexual trauma that hasn't been addressed. And so things are not, intimacy is not optimal because the person is bringing in that trauma that comes from that. And it's very difficult to be in the natural ease and flow that allows for that to happen. There can be other, and that's not to say every single situation is that. That's one of the situations. It can be other situations. It can be is sometimes I found this is there's underlying issues in the marriage that are not being resolved, or there's fears from past relationships or from child. There can be so many underlying issues, inherited or things that you've been through. And that's the thing. We need to start moving away from this idea that our emotions and our physiology are different. They are so intertwined in ways that you cannot even imagine. So if you need to treat something, whether it's fertility, whether it's anything, you need to treat it from a truly holistic perspective, which is I think what we touched on last time as well. Also, another very important one for fertility, and one that is not often spoken about, is the whole masculine feminine balance. And that's something that I really want to delve into more in the future. But for now, the masculine feminine is, a lot of us females, sometimes we have been grown up in such a way that the masculinity comes out too much. So there's too much of there's not enough of the feminine flow that comes through, and that can affect fertility and hormonal balance a lot as well.
And I think also in this day and age, when more women are working and take on more male responsibility than maybe generations ago. And for a man, that can alter his physiology in terms of the way his reproductive organs work. Whereas for a female, they then just become more masculine in the way they become the dictators in the home. But that being said, a lot of what we're saying then could sound like maybe it's just all psychological, or is it all just pseudoscience? But there actually is a science behind it.
Psychoimmunology. There's an actual science.
There's a biochemical reaction that happens to you when you go through trauma. An emotional response, an emotional effect on the body can produce a physical response. And what happens is, in these patients, it affects their cortisol. So they stressed, and then all of a sudden their phone alarm is going off the next morning, and that is another stress, and that is what we call a micro stress. And then maybe they need to rush off to work, or there's some angry person on the road, and these are all micro stresses. But brewing underneath that, there's some emotional aspect that has really taken its toll, or maybe it was something that triggered you off years ago, and now you have these tiny emotional or micro stresses around you, and you start to produce cortisol. So cortisol should be produced when you are, it's like adrenaline. You produce it when in your flight state. You need to run away from a dog, or somebody's chasing you, and then your body goes into this response where it produces cortisol and adrenaline, and it shuts down unimportant organs in the body, and it revs up things like your heartbeat. And if your cortisol is constantly high because you're constantly stressed, then it's going to affect estrogen, progesterone, and insulin. And then in turn, those are going to it's also going to directly affect your thyroid gland. And that's why we find that people who are constantly stressed or have many multiple years of small triggers eventually develop, although mentally they feel fine, they actually have a lot of underlying things going on. They develop things like hypothyroidism.
So let's talk about stress a little bit, because stress is something that none of us can run away from. It's a normal part of life. If it's all good and well to go and sit on a mountain somewhere and meditate all day, but the fact of the matter is we all have to live in a world where we have family, where we have work, where we have responsibilities. So stress is a normal part of our lives, and you actually have healthy stress and you have unhealthy stress. So there's almost like a curve, right?
Yeah.
If there's no stress at all, then you go into lethargy, you're not motivated, life is just unexciting.
Yeah.
So you need to have a certain level of stress to keep you going, to keep you motivated. Just like you need a certain level of cortisol in the morning to get you going. You want to have that drive, you want to be passionate about something and feel motivated. But when that stress becomes overwhelming, that is when you start to go backwards. That is when there's a direct link between high levels of stress and a suppressed immune system, a compromised gut microbiome, and so on and so forth. And these lead to hormonal issues, it can lead to symptoms, which then can lead to infertility, all sorts of things. So everything is interconnected and you have to work backwards, right, to get back to it. An important part about the stress is it's unavoidable, but what is avoidable, or what is under your influence rather, is how you deal with your stress. And for a lot of us, we have very poor stress management skills. We kind of, and I think in today's society, I see women all the time, we think if we plot and plan everything down to the T and everything is just as it's supposed to be, then everything is fine. So A, B, C, D needs to happen at exactly this time and exactly this way, and the minute one of those little dominoes falls down, that's it.
Then
we are falling apart. And so a big part of dealing with stress is, number one, letting go of this idea that everything has to be perfect all the time. In Islam, we have a beautiful concept. It's the month of Ramadan, and we have this beautiful concept of ihsan. And ihsan is striving for excellence. So in everything that you do, you put your whole heart in, you do it to the best of your ability, you do it as beautifully as you can. And then you leave the outcome up to the Almighty, and you realize that you have no control over the outcome. All you have influence over is how well you did, and that too within your capacity. Because I think, Dr. Baker, we also need to realize from day to day we all are different. Especially we as women, we have a 28-day cycle. We're different throughout that cycle. We're different. There are some times where you will feel very productive, you will feel very organized, and there's other times where your energy will start to waver, and you need to give yourself allowance for that it can't be perfect all the time. And it doesn't have to be perfect, right? So you can kind of go with that. The other thing is, if you can be more adaptable to situations not going your way, so you have everything planned, A, B, C, D, and then something happens and this part doesn't work out, that you have to be flexible and adaptable. I think in business you learn that as well. If you want to succeed in business, you just have to be adaptable, and then you try your best, and if things work out, alhamdulillah, and if it doesn't, then you have to try again another day. So try not to get too attached to the outcome of every single thing. Try your best, knowing that your best will change from day to day. Be adaptable when things go wrong, and don't get attached to the outcome. Those are huge in terms of helping you deal with stress better.
I think we have a question or a comment.
Okay, there's one for you. I have had a full thyroidectomy done, and I am on L-troxin as a replacement, but of course with everyday stresses or pressures affects the levels of the thyroid. What can I take as a supplement? That's a nice one, because a lot of people are struggling with thyroid issues.
Is. So because this patient doesn't have a thyroid gland, there's nothing. So if you still had some part of your thyroid gland.
Oh, I've had clients with that. Yeah.
Then we could actually help you to make that gland function by taking the correct supplements like fucus and withania, bacopa, zinc, selenium, and vitamin A, mostly those. And you don't have to take like 6 different things. They are available in complexes to your functional medicine practitioner or your complementary doctor. And then if you don't have a thyroid gland, then you want to focus on where is the...
You're getting cut out in your ones.
So we want to focus on what is causing it. What's behind you having the need for that thyroidectomy? Why did you have to remove your gland? And maybe it was because your thyroid gland was really out of control. But what was causing that? Maybe it was the cortisol. And then you want to treat the cortisol by using herbs that are going to help with adrenal gland function. But then you also need to look at why is the cortisol high, and maybe that is the stress, so you're not managing the stress. And like we said, you can't take away stress from somebody, but you can help them to manage it better, or by having better life systems in place, or trying to get over certain things in a certain way without just shoving it under the carpet. So for this patient who had a full thyroidectomy, it would be wise for you to see your practitioner or your functional medicine doctor to assist you with looking at what was behind the need for that thyroid removal, and then focusing on treating that root cause.
I just want to say something. 786 something said, Munira, I think we can treat you with some sabr. I think that's very insensitive, and you should actually apologize on the live because everyone's degree is different, and you are not in her shoes, so have some compassion for that.
Yeah. So yeah. So always look at what was it was due to
thyroid cancer. So the sister had thyroid cancer, so you can keep judgment to yourself. Okay?
Yeah. So look at that. Now, what would cause somebody, or even a young person, to develop cancer? We're not saying everything is psychological. We're saying that sometimes emotional and psychological.
The symptoms feel very real. When you're having symptoms, they are very real, but how
do you measure tiredness in a person? A person with a thyroid dysfunction is feeling tired all the time. How can you measure tiredness in a person? You can't. So that is something that would border on whether it's mental, emotional, or physical. It's somewhere in between. But what are the effects from feeling tired? Me saying to my husband all the time is, I'm tired. He's gonna get annoyed with me. You don't want to hear that from someone repeatedly. But also put yourself in that person's shoes. If you had thyroid cancer and you were feeling this way, and yes, maybe you can't just treat it with any alternate medicine, but look at what caused the cancer. And we spoke about this last week, where we said maybe someone who's lost their child or lost a parent, they have issues with breast cancer or uterine cancer. It's trauma, and it's trauma to the female, the female heart, basically. And that can elicit a physical reaction from the body.
Yeah. Definitely. Thank you for apologizing. That's fine. It's an oversight. Just to keep things compassionate here. That's very important, right? This is all for everyone's benefit, and this is not a place for judgment. So thank you for that. I appreciate it. So, and something that we don't think about also is if it's thyroid issues, although it's not a one-size-fits-all approach from an emotional aspect, I find in dealing with clients, although it's not so cut and dry, what you do have to take into consideration, if you have thyroid issues, thyroid is very connected, emotionally, it's very connected to your voice and your ability to speak up. So if you're having thyroid issues, ask yourself, where in my life am I finding it difficult to communicate my truth? Where's there distortion maybe in somewhere in the way that I'm communicating? Do I need to find more effective communication strategies? I think us as women, sometimes we grow up in environments where we're not allowed to speak out. We're kind of told that we don't have a voice and we can't say anything. So thyroid issues can often be linked to suppressing the voice and not speaking out clearly enough. So if thyroid issues are something that you're dealing with, then ask yourself, where can I speak my truth more?
And then also you find that these patients generally, they become, anyone who has, if you're diagnosed with hypothyroidism, you'll know that a component of it is that you feel depressed. It's one of the symptoms is depression. And although depression is not a diagnosis, it's not the end. It's not something you would diagnose someone with. You always look behind that. But that is a major part of it. And then other symptoms like hair loss and fatigue and constipation. And constipation on its own is somebody holding something back.
Yeah. So the large intestine is a lot about holding onto things. It's also about control. You find people who have gut issues, it's often about control, perfectionism, not letting stuff go as a protective mechanism.
Which is so linked to like the psychological aspect of what we're talking about in hypothyroidism. You can't talk about something. You can't let it out. You can't engage with someone else about what your issue is, and you just have to keep it inside you. But if you could, would it help your gland function? I think first, emotionally, just talking about it would make you feel better. That's the number one thing. Many patients or clients would have said to both Zaahida and I that I feel better after I just spoke about it.
It's just they have a space to air what they need to say without judgment, without anybody coming down on them. Somebody just giving a compassionate ear, right? So that's something that we all need to practice a little bit more as well.
So we're just letting the conversation flow to wherever it takes us. It just so happened that we started with fertility and we moved on to thyroid dysfunction.
So you're welcome to ask your questions if there's anything.
And sometimes that happens in a consult as well. A patient will come in, okay, for me, maybe a patient came in for weight loss, but then we end up talking about something else that's bothering them and something that's affecting them physically. And at the end of it, it might be actually an emotional response
Definitely.
by the body saying, I need help. Please help me.
Yeah. So I think anything where you'll find that, well, I find this a lot, I'm sure you do as well, that when a client comes in or a patient comes in, they don't come in with one thing.
No.
It's usually a combination of emotional stuff and physical stuff.
Yeah.
And then you'll find as you go along, it seems like it's very disconnected, but all of it is interconnected.
Yeah, and I think also people generally want to know what can they do to lower their stress levels. And I feel every patient is different, but I like to ask my patient to do something that they can do to that makes them happy.
Yeah.
It can be anything. It can be painting or some artwork or reading a book, but 5 minutes of your day just to do something that makes you happy, because we're too busy doing things for everyone else. You know, we're dropping off for kids, picking up kids, dropping at madrasa, come home, prepare supper, then make tea, go to bed, read salah, go to bed, wake up the next morning, and you're back in the same routine, but you don't actually do anything.
Right. Somebody asked it. The first question is there a general way to control stress for everyone, or would it be personalized according to the person or patient? Excellent question. So yes, there are some generalized stress management techniques, which I'm going to be teaching really soon in an online course that's coming out, inshallah, by the end of this month. So keep posted, keep tuned in, and you'll find out when it's released. So there are general things that you can do. However, sometimes depending on the severity of it and depending on where your emotional resilience is at, you might need a more customized approach. If there's a particular situation in your life, let's just say your marriage is causing you a lot of stress, then you need to start engaging in what's going on in the marriage. Maybe I need to change my communication strategies. Maybe I need to change my perspective. Stress management is a lot about shifting perspective and dealing with situations differently, shifting your perspective of what's expected of you as well. Sometimes I think we live in a society where we have extremely high expectations of ourselves, right? We feel like we need to do everything, be everywhere, be everyone, and then we have social media adding that, and then you're seeing all these people living these glam lives and doing this and doing that. And you're looking at all of this and you're not realizing that they also have normal situations and normal lives and normal difficulties,
and
right?
you don't see all of that normal difficulties.
Nobody talks about that stuff, right? Except on my page, I talk about it. So the point is, there's all this going on. So yes, there's a certain amount of stuff that you can definitely learn. And then there are some customized techniques depending on your situation. Like I'm saying, it's about getting very honest with yourself. Is my stress largely coming from my marriage? Is it largely coming from my work? Is it largely coming from from raising my kids? I do find sometimes we tend to overemphasize certain situations and deflect from those situations that are difficult to look at. So for example, someone might be having an issue with their marriage, but they don't want to think about that, so they overemphasize the issue they're having with their mother-in-law, and that takes center stage, but you don't actually want to deal with it. So it's a lot about having awareness and being clear with what is going on. And so one of the easiest things I can ask you, that you can tell you today, that you can start implementing today, is like Dr. Baker said, take time for self-reflection. So maybe after Tarawih today, sit with a cup of something warm to drink, something that you enjoy. Take out a piece of paper, take out a journal, and say, what are my biggest stresses? And write down what that is, and then ask yourself, okay, how can I shift my perspective in each one of these to make it a little bit easier for myself? So if I started with a 9 out of 10 of stress, or what would I need to shift within myself, my own thinking, to take it to a 7 out of 10? Remember, Einstein said that you cannot solve a problem with the same consciousness that created it, with the same mindset that created it. So in order to deal with your stress, to find solutions for it, you need to first change mindset. Mindset is the most important thing. So open up the mind to see it from different perspectives. That's going to be very valuable for you.
Definitely. So these are small tips that we're giving you where you can actually see big results. There was this this podcast that I was listening to where a patient had seen a doctor. The patient tried to commit suicide, and he was then suggested to go and see his doctor for an antidepressant, and he was only 16 years of age. This was in the UK. And so the doctor happened to be a functional medicine doctor who understood that there's a relationship between the functionality of a human being and not just the brain being separate from the body. So he decided that this child is 16 years old. There must be a reason. He understood the family dynamics. There was nothing hectic or strange or unusual going on. And then he got speaking to the person, and it seemed like social media was a bit too much. And he decided that the treatment method would be, let's take away an hour of social media every evening and every morning and see how the child does. And that child never needed to go onto any medication. He recovered he recovered from the sort of anxiety and depression that he was suffering from, just by cutting back on an hour, not even taking it out completely. I mean, we use social media all the time. We're not using it in a negative way, and we're also not using it to spread negativity. I feel a lot of what we see that happens on social media can affect someone else by making them think that their life is not as perfect as someone else's. And by sharing what goes on, I mean, I know the way Zaahida does it is she won't, it doesn't become a drama. You know, you're not watching a soapy, but she makes you understand that there's a real life situation behind every individual. Somebody asked, what can you do about anxiety and depression?
So somebody asked, anxiety, can general anesthesia cause anxiety and depression?
It can actually, so side effects of general anesthesia can include changes in mental status or mental ability or function.
Okay.
You can treat that. You can actually sort of antidote the side effect of it. But if you need a general anesthesia and you have to take it,
temporary.
It's temporary.
So how long would if it's from the anesthesia?
Days,
so it should be only a few days. It shouldn't be going on for once a month.
If it is, then obviously something has really been altered in your system, and you need to treat that. But why did you need the general anesthesia? Let's look behind everything.
Yes.
Let's look at why. Maybe you had an operation. Maybe you had a colon, something to do with your colon. Let's look at the colon. Let's look at the gut microbiome. See if it's balanced. Balance it if we can. And then what are the associated symptoms? Sometimes I've had 2 patients recently tell me that they have a little bit of, one patient said to me she has hot flashes all the time, like the whole day she's having hot flashes, and yes, she is perimenopausal or premenopausal, but I didn't think all of those hot flashes were related to just menopause. There was a certain component that said that this is stress and this is anxiety and this is actually a panic attack. So we're treating her both for menopause and her panic attacks together. Whereas there would be somebody else who would say that I keep getting this feeling inside me and feels like my heart has skipped a beat. I'm not having palpitations, but I'm skipping a beat now and again, and it's like a flutter inside me. Or somebody else would say I have this constant need to burp or a constant need to cough. And that is actually related to the anxiety. And you wouldn't treat this person for the coughing or the bloating or the burping. You're going to treat what's causing that anxiety, both psychologically and physically, using the appropriate supplements. Sometimes food can help you because your gut and your brain are related. If you're having poor things in your diet, lots of inflammatory foods, lots of sugar, then your gut is going to send a signal to your brain and you're going to feel anxious. In the same light, when you are anxious, your brain sends a signal to your gut, hey, I need to go to the loo because I'm stressed about this exam I have to write. And we all have experienced that. So there is a link. There has to be a 2-way connection. It's not just one way.
Yeah. What is iron deficiency linked to? That's a really good question, because iron deficiency, it's more common in females, isn't it? So why is it so common in these days to be iron deficient?
It's a good question.
And what is it linked to? So we spoke a lot about gut microbiome. So in last week's one, we spoke a lot about gut microbiome. If your gut is not healthy, if your gut lining is compromised, then you're not going to be absorbing your nutrients from your food effectively, and that will lead to all kinds of deficiency as well, right? Also, you have precursors to iron. In order for iron to be absorbed, you need vitamin C, you need adequate amounts of vitamin B. So there's all of that. But what are some of the other things?
You see, if you look at your gut itself, there's a wall between your gut and your immunity. And if digestion is compromised, or we're putting in the wrong things into our diet, then that intestinal lining is going to be compromised. And what's on this